What's the correct saline to use when reconstituting tox and why? Most of us are using 0.9% bacteriostatic saline. So why then does Allergan, MERS, and all the others tell us to use non-preserved saline? First, manufacturers of toxins and any other pharmaceutical can only discuss and advise in accordance with their FDA approval, meaning discussion or advice that moves outside of how they conducted their FDA clinical trials is strictly off limits to them. All the currently approved FDA toxins used non-preserved saline in their clinical trials. And that's why all the package inserts direct us to use the non-preserved saline. But once a product has FDA approval, the scientific community immediately starts to conduct their own research. And I'm talking about large, multi-center, double-blind, placebo-controlled trials. I'm not talking about those case studies where people have tried it in certain ways and it seems to work. Community standard requires a lot more than just a few case studies. But once those random, controlled, rigorous trials are completed and the scientific community is in agreement, that then places it within the community standard. And that's the case with using bacteriostatic saline for reconstitution of toxins. When we use that non-preserved saline that is described in the package inserts, we have to use that toxin within 24 hours. And whatever's left after that has to be discarded. But when we use preserved saline, the CDC says we can use it up to 28 days, and we have to discard the remainder after that. And it's not because the tox loses its efficacy. The research there is very clear. It absolutely remains viable. The concern then becomes bacterial growth, and no one wants a facial flesh-eating bacteria on their watch. Here's a few other points. Be sure what you're using is sterile 0.9% physiologic or normal saline. Higher percent salines, like 3 and 5%, are available, but we can't use those. Those are hypertonic salines. Those are used for problems like hyponatremia and increased intracranial pressure. Hypertonic saline is an osmotic agent that can damage cell. It causes sclerosing of vessels, and it can even cause skin necrosis. So we should never use it as a tox diluent. Likewise, bacteriostatic water should never be used with tox as a diluent. It's hypotonic and can cause local cells to swell, burst, and cause lots of pain and tissue damage.